Good morning, everyone. We're going to give just a few seconds for everyone to get in, and then we will get started. All right, we're going to get going here. Good morning and welcome to today's Recovery Summit session. This webinar is part of the Recovery Summit series hosted each September by St. Clair County Community Mental Health in recognition of National Recovery Month, a time to celebrate recovery, raise awareness, and highlight the importance of support and connection. A few quick things before we get started. Today's session is being recorded and will be available on the St. Clair County Community Mental Health YouTube channel probably at the beginning of October. Please use the chat box for any questions or comments. Our presenter will address them as time allows. For those requesting continuing education credits, please be sure to remain on the webinar for the full session and complete the survey that will be emailed to you after. It's my pleasure to welcome back our presenter today, Maddie Tortomasi. Maddie holds a bachelor's degree in criminal justice and substance abuse prevention, education, and intervention from Central Michigan University and earned her master's of social work degree from the University of Michigan. She currently serves as the director of community education at Face Addiction Now, formerly known as Families Against Narcotics. Welcome, Maddie.
Hi, thank you for having me, and good morning, everyone. Thanks for being with us on this beautiful Monday. Like Christy mentioned, my name is Maddie. I am the Director of Community Education at Face Addiction Now. So in my position, I get to oversee all of our education and prevention initiatives across the state. And part of that is we have an SPF RX grant from SAMHSA, which is just a strategic prevention framework for prescription drug misuse. So we have a specific grant, and through this grant, we've been able to do education to a lot of different people. So today's presentation is going to be focused on like a whole general community perspective. We tied in national and Michigan statistics, but also I'll be talking about our youth a lot today because each generation we're seeing different trends and changes. And part of our prevention is that we go into schools and we talk about prescription drug misuse. And in the past almost 4 years now, I've learned a lot from teens about what is actually happening in their demographic. And so we'll incorporate that as well. And so talking about all the different trends and whatnot. So I will keep an eye on the chat. So if anyone has questions about the presentation or whatever I'm talking about, feel free to put your questions in the chat and I'll try to keep an eye on it and answer them as we go. And then Chrissy will oversee any questions about like CEUs or anything like that. So for today, so we'll talk about the problem, what is prescription drug misuse, the risk factors and warning signs. I'm also going to talk about safe practices and prevention because that's super important, especially with our young folks. And then a little bit about treatment support, and then what we can do as a community to prevent prescription drug misuse. Super important, and obviously takes an entire community to combat this problem. So when we talk about the scope of the problem, we all know that prescription drug misuse is not a new thing. It's been around forever, and unfortunately, it got super polarized during the opioid epidemic. And from there, we've seen an increase and then a decrease and back to an increase of prescription drug misuse. And over time, like the landscape of it has really changed, but 16 million Americans aged 12 or plus misused prescription drugs in the past year. That's a statistic from SAMHSA. And what's really scary about this is that the statistic begins at age 12. And through all of our prevention efforts, going into schools, talking to young folks, I can tell you firsthand that this age marker is 100% true. Kids are now younger and younger misusing prescription medication. And it's horrifying, it's really scary, and it still goes to show that there's still a lot of education and prevention that needs to be done. Obviously, that's a national scale. But when we talk about Opioids, obviously, we're all unfortunately probably got our jobs because of the opioid epidemic working in the substance use field. If you do work in that field, prescription opioids involved in nearly 70% of all opioid overdose deaths nationally. That should say all overdose deaths. Opioids are very much still involved. It's still very much a problem, but we're starting to see a change in the amount of opioids that are being prescribed, obviously, and other drugs coming up and being misused. When we focus on Michigan data, there is over 1,900 overdose deaths reported in 2023. 2024 numbers haven't been officially confirmed yet. Approximately 70% of involved opioids. What we have known is that overdoses have gone down in the state of Michigan from 2023 to 2024, which is amazing. And Michigan is honestly doing a very good job, and it's probably directly contributed to the investment in naloxone and harm reduction programs and prevention programs in the state. But obviously, there's still a lot of people who are passing away every day. It turns out to be around 6 people in the state of Michigan every day, give or take. The data for prescription drug misuse, for overdoses, is a little inconclusive because not all of them are reported in the way that they should be. There's no central data collection site for the state of Michigan regarding overdoses. Every municipality handles it very differently. And then also, if somebody does overdose, their cause of death may be respiratory, arrest or cardiac arrest. And so there are some inconsistencies. So we can kind of assume that it's probably more. This data is very hard to get. Another statistic is approximately 5% of Michigan high school students reported misusing prescription painkillers. Another thing that is really difficult about getting data, especially from young folks, is I know when I took like the MiFi when I was in school, I was not honest about what I was using regards to my substance use. So we can assume that most kids aren't telling the full truth of whether they've engaged in substance use or not. So I like to think maybe this number's a little bit higher just because no one wants to be open and honest, especially when they are a juvenile about if they're misusing prescription drugs. So it's still happening. I'm always surprised when we have our prevention initiatives in different schools, how many students we use an anonymous platform where they can enter their the results or their answers to these different questions. And so I will ask have you misused prescription medication in the past year? And I'm always shocked at how many people say yes. And so when we talk about what is prescription drug misuse, there's 4 different main categories that we can break it up into. And this is really, really important when we're educating folks about misusing their prescription or taking them appropriately. So the first way is taking medication in ways that is not directed. So either using a higher dose more frequently than they were prescribed or longer periods than they were prescribed. So really highlighting the importance of reading the prescription label, knowing when it is appropriate to take a medication. Using somebody else's prescription, so taking medication that is prescribed for another person, even if it is for a legitimate medical reason. So I know there may be times where people get prescribed like Motrin 800 and they take it from a family member, which is simply just, I think it's 4 of the little Motrin pills, but it's a prescription medication. That is technically prescription drug misuse. And that's what I really try to hone in on and educating, because it's as simple as that. Taking medicine for non-medical purposes is kind of self-explanatory. So if we're using medications in order to experience euphoria or to get high instead of their intended therapeutic effects. So obviously that's like a big warning sign that someone is, misusing prescription medication. And then also using the wrong method. So whether someone is crushing, snorting, or injecting pills that are designed to be swallowed. So that is obviously, on the other end of the spectrum of really dangerous prescription drug misuse. But they're all really important to educate on and to, tell young folks, especially, the dangers of taking prescription drug medication, that in the manner that they are not originally intended for. So when we talk about commonly misused prescription drugs, so this is on a national scale. So obviously we have our opioids meant for pain relief. Most common oxycodone, oxycontin, hydrocodone or Vicodin, codeine, morphine, fentanyl, Norco, anything that's prescribed for pain relief. Obviously there's a lot more prescribing restrictions now. And so when we talk about opioids, I always focus on the dangers of like buying them off of the street or, how most of them are fake or pressed pills now, just because it is really important for people to know how dangerous it can be. One of the conversations I always have with youth is around um, opioids in a different manner than what we would have done 5 or 10 years ago. So obviously, through the opioid epidemic, opioids were being prescribed, led to a huge number of people using uh, heroin and then fentanyl. But opioids now are being prescribed in a different manner, but they're also being used in a different manner. So I tell this story because I was honestly flabbergasted when I heard this. So last year we were in a middle school, I think, or no, it was a high school. And I had a 14-year-old come up to me at the end of the session telling me that he was addicted to opioids. And I was not like thrown off by that because I work at an organization that helps people every single day. So I just was kind of like um prompting him to like answer some additional questions of being like, okay, like how did you get these pain medication? Like what was the original intended use for it? And what are you like, why are you using them now? And he said that he was using opioids and became addicted to them because he was trying to prevent ejaculation while he was having intercourse with his partner. And that was honestly like so shocking to me. And I was honestly flabbergasted by that because I had not heard of that. I've heard of it from like older generations who were maybe struggling with substance use, but I had not heard it in the context of a 14-year-old. And so I was asking him more questions, and obviously we got him the services that he needed. That was the most important part. But he said that there was a big group of students who started using opioids so that way they could last longer while they were having intercourse. And now there's a whole group of students that were like 14 years old who are now becoming addicted to opioids because of the original intent was different. And I was so shocked. And it really started off with like us. It really started a pattern where I started noticing that more and more and hearing more about it. And I started asking questions for young folks about it. So opioids are still a problem for the younger generation. Obviously, the prevalence of using opioids has gone down. It's really shifted towards stimulants and benzodiazepines, but it's still very prevalent. When we talk about benzodiazepines and stimulants, and I love that more and more people are becoming in tune with their mental health, that are seeking out services in regards to their anxiety and their depression. From a clinical perspective, I do think that some benzodiazepines are overprescribed, specifically like Xanax and Klonopin, even Valium. And these medications are obviously prescribed for anxiety, for panic, and sleep issues. But the amount of benzodiazepine use in the state of Michigan has gone up exponentially. It is really not directly contributed to the rise in mental health concerns and also addressing mental health concerns, but it really is like the new fad, along with stimulants, Adderall, Ritalin, Concerta, Vyvanse, anything that's prescribed for ADHD or narcolepsy. We are seeing a huge amount of young folks who are misusing stimulants, specifically because of social pressure, academic pressure, also sports pressure. I was working with some kids at a local high school, and they were telling us that the expectation is that everyone goes and gets a bachelor's and then a master's. So they have to do really well in high school. And so therefore they're going to use prescription medication in a way that is not originally prescribed to them, because they feel this academic pressure to excel because there's a social pressure to go to get your bachelor's degree and then your master's in order to be successful. So we are seeing a big rise. Benzodiazepines, of course, are always very popular with older generations as well. especially like that parenting age. So you talk about like 25 to 35. There's a lot of people who are prescribed like Xanax and whatnot. It's the parenting age because there are so many stressors that are involved with parenting. And then lastly, are sleep medications for insomnia and complex sleep behaviors. So that may be Ambien, Lucenta, and Sonata. Those are just three of the most popular. We do see a lot of older generations misusing that as well, which in my personal opinion, I don't know if people misuse that and stay awake, but a lot of people take it so that way they can sleep for long durations, or if someone's struggling with sleep, they're giving it to somebody else to take. So this is just from a national perspective. Obviously, each county in the state of Michigan, each city is going to be completely different depending on, what the makeup is, whether it's suburban or rural or whatnot. But overall, these are the four most common misused prescription drugs. So talking about those risk factors for adolescents, peer pressure and social influence is huge. I always say new generations, new problems. The rise of social media, the normalcy of people taking medication, talking about it is great for a certain extent. It also can be very dangerous. Social media and influencers who are glamorizing drug use, alcohol use, and whatnot, it becomes extremely dangerous, especially when their social media is not being monitored and parents don't know what these influencers, if you will, are posting. I always ask, adolescents, who's one of the influencers that you know of that glamorizes like drug or alcohol use, and they'll name off like 4 or 5 right away. So they know that this is happening, but they're still engaging in that content, and that content may decrease like their or excuse me, it might make them less nervous to engage in like dangerous or risky behaviors. So also, mental health challenges. So we've seen a huge rise in this generation of young students with anxiety and depression. Some people link it to COVID. Some people have their own, link it to social media. Other people have their own ideas of why this may be. But kids nowadays have way more mental health challenges than we've seen in previous generation. And then trauma or adverse childhood experiences. Of course, anyone who has engage or who has had any adverse childhood experiences is more likely to develop substance use. Easy access to medication at home is always a big one, and we'll talk about safe storage because it's really important. I know most kids say that they get their medications or their alcohol from their parents or from a family or friend just because it is not secured properly. Academics, performance and stress, I talked about that a little bit before. And lack of knowledge about prescription drug dangers. Obviously, if you are getting something that's prescribed by a doctor, usually we are taught to trust our doctors. They are the most knowledgeable or whatnot, but also our medical community may not be doing or may not have the best description of like what these pain pills are and the dangers that are associated with it. And they may put it on the pharmacist to explain it, but the pharmacist may not explain it because they may staple that really scary paper that probably has like 4 or 5 pages about the dangers of these prescription medications. So ultimately, it's left up to the consumer to have to read through all the dangers themselves and educate themselves, which is not always going to happen, especially for young folks who are just taking it because their parents took them to the doctor and the doctor said, you need to take this. And then lastly, experimentation and risk-taking behavior. We are taking risks for our entire lives. It's no different for adolescents. They want to experiment. They want to engage in things that other people are engaging. It's a pretty normal circumstance, but we need to make sure that we're providing them with the education about the dangers that are associated with prescription drugs. So when we talk about our adults and different risk factors, it changes. So adults aged 35 to 54 have the highest rate of prescription drug misuse in Michigan. Older adults are now having some more issues too, which I'll talk about, but there's mostly 3 different factors that come in. Chronic pain conditions. So the older you get, the more likely you are to develop, pain conditions or any type of illness. If someone has a history of a substance use disorder, usually later in their life, they may start using prescription medication. Co-occurring mental health disorders, of course, it's the chicken and the egg situation usually. People may use medication in order to try and address their mental health concerns, but it may exacerbate their substance use, or it kind of becomes this big intermeshing circles. And then there's also multiple prescribers. I think about like myself, like I see, an allergist, an immunologist, my primary care doctor, and like you go down the list of how many people that you see, and they're all prescribing different things, and there's no collaborative of like what medications you should and shouldn't be taking, whether it's together or you're taking too much of one thing and not enough of another. Our care, and I'm sure we all know this, our care collaboration is 0 to none, unless like you do have those collaborative teams in certain circumstances, but it's not really going to happen for most people. There is still a lot of people who do doctor shopping. It's less common nationally. So simply where you're traveling to a different area to go to a doctor to try and get the same medication. In Michigan, we have a unique circumstance where some people travel to Canada and try doctor shopping in Canada. So obviously those medical systems are not connected. There's no central reporting system, across different countries. There's no central reporting system throughout the United States. So people may travel to Ohio, they may travel to Wisconsin, they may travel to Canada, and they're trying to get as much medication as possible, or they're buying the medication without insurance, with cash, so that way it's not as trackable. So it does still happen. Not as common, but still happens, of course. So our social factors, if someone is, very isolated, they have a lack of support, they're more likely to engage in any type of substance use. You have a family history, of course. There's access to medications through family and friends, like I talked about, where, it's just easy to go and take one. No one's really going to notice. And exposure to environments where drug use is normalized is a really, really big risk factor for children and adults. I talked about, lowering your inhibitions about what's dangerous. It's just a normal risk-taking behavior. If it's anything that it's your normal, you're not going to be afraid to engage in these types of behaviors because of people around who are using drugs. That's your normal, and it's not scary. And then our economic factors, if someone is experiencing unemployment or financial stress, they are more likely to engage in substances. If they have limited access to healthcare and they're trying to manage it on their own, there's a higher rate that they may misuse prescription medication because they just can't address the root problem. They're trying to manage pain. Housing instability, of course, and then working in high injury occupations. So construction, any type of like working in an auto plant on the line, anything that's high labor or blue collar jobs, if you will. We see a very high rate of prescription drug misuse, a very high rate of substance use, a very high rate of overdose within those types of job markets. And they're commonly people who have experienced substance use in their past, who work in those types of environments, or there's a direct correlation. So it can be, what we do for our prevention is we really try to work with those different job markets to make sure they're educated about substance use, about services, and about overdoses and how to respond, because it's super important. So when we talk about warning signs, I always like to give the caveat in the beginning of, these are just kind of open suggestions that something may be going on. Obviously, I always like to say, if I don't get 8 hours of sleep, I may experience mood swings or personality changes. I might have social withdrawal or isolation. There's a lot of different things that can contribute to someone's behavioral, physical changes. It's not always directed to substance use. But if you have someone in your life who's like displaying one of these signs, maybe it's just an idea to check in with them. Hey, how's it going? How are you doing? Just to make sure that something isn't going on, even if it's not substance use, but maybe they're just having a hard time. Super important just to check in with the people that we know and we love if we see these types of changes. We shouldn't be seeking out and looking for these types of changes in a person in order to be like, oh my God, you're misusing prescription medications. We don't want to do that. Just think of it as, okay, I should probably check in with them because something's up. So the direct warning sign for prescription drug misuse, like I talked about, is the changes in medication use. This is something that may be easier to spot out. So we talked about using medications more frequently than prescribed. They're running out of medications early. They're doctor shopping or seeking multiple prescriptions. Claiming lost or stolen medication frequently. That's another popular one as well. Those are easy. Okay, something's up. The behavioral and physical signs, not as easy to detect if it's directly related to substance use or prescription drug misuse. But like I said, just, all right, maybe we need to check in. Maybe someone's experiencing mood swings or they're having those personality changes. Maybe they're having secretive behavior about medication use. Maybe they are withdrawn or they're isolating themselves or they're neglecting all their responsibilities, which could be, their family, their school, their home, their job, their work, anything. They're just not showing up in the way that they once were. And then our physical signs, these are always different depending on what somebody is taking. So, changes in sleep patterns or unusual drowsiness or hyperactivity, once again, depends on what type of substance they're putting in their body. Poor coordination or slurred speech, and then changes in appetite and weight. So just some things that we can keep an eye out for. But especially if you're working with someone they're being prescribed a lot of medication, definitely keep an eye out of making sure none of these things are changing frequently or pretty drastically. So when we talk about dependency, so when someone is taking medications more often than they are prescribed, or their body is becoming dependent on it because your body just really likes it, there are some signs. I think this is pretty important to know when someone is. Sometimes it doesn't always directly lead to misuse, but they feel like they can't do anything without their medication. So they may be taking it as much or whatnot. So when someone starts developing a tolerance to the medication, our bodies start to adjust. They start to decrease the amount of side effects that we once have to them. We may need to start taking more doses than we originally were prescribed to get the same effect that was once achieved by just as prescribed. If someone is experiencing withdrawal symptoms, so physical or emotional, they're having flu-like symptoms, sweating, shaking, um, fever, and they are also experiencing the emotional ones like anxiety, depression, irrational thoughts. Some people can become very compulsive when trying to reduce or stop a medication use. That is really, really scary. And then that leads into like our loss of control. So they're unable to stop or control their substance use, and despite of negative consequences or the desire to stop. So this is when prescription drug misuse becomes really, really dangerous. And where we see a lot of people where we lose them from overdoses because they're taking way more, they don't care about any of the negative consequences, and they continue to use despite, the causes that it has on their health, social, and personal problem. They don't really care about anything else besides using that medication. So the step 3 and 4 is really where we see the most dangerous, where people need help. There needs to be some type of intervention. They usually can't come off of those medications by themselves. It could be extremely dangerous to withdraw off of some prescription medications by yourself. There needs to be some medical intervention. And so that's really where we see where we lose a lot of people. So for our prevention strategies that work, so we want to encourage people to not be afraid to take medications. I think that's also some of the problem too, is that people are scared of taking medications that can really help them because of all of these factors. But really what's about is patient education programs. So they need to understand the medication risks, how to properly use the medication and properly store medication, so that way they can make informed decisions. So providers really have this, they should be doing this part of their education as well as pharmacy people. And we also need to educate our patients on reading all of the risks and the big, long, scary packet that's associated with it, because we want them to make informed decisions and we want them to know, how dangerous it can be to misuse prescription medication. There are prescription drug monitoring systems. So the state of Michigan has a database called MAPS. It's called the Michigan Automated Prescribing System, and it's used to track controlled substance prescriptions and help identify potential misuse patterns. Also to prevent doctor shopping within the state of Michigan. So anytime that you are prescribed certain medication, usually, narcotics, there's certain schedules of medication. And when you are prescribed it, it's put through the system, and you cannot get any more medication within the same class while you are still using your prescription. So when I had a hip surgery about 2 years ago, my doctor said that he could only prescribe 5 days of opioids at a time, and I could not get it any sooner than that 5 days. And that was because of the MAP system. So our executive director at FAN worked with the state of Michigan to help develop that system. It works and it works pretty good, but people have to actively check it. And it's not like it's a little bit of a more complex system where pharmacists have to actively check it and do the research every single time. And doctors just put it in there and just put their prescriptions in there. A lot of time doctors aren't really doing the research on the system. So things can get overlooked and whatnot, but it's still really important for our providers to use the system, to become familiar with it and to report any type of prescriptions as much as possible. So that way we can spot any doctors who are overprescribing as well. They use the system for that. So our community outreach, we should be raising awareness, providing education, and offering resources to prevent prescription drug misuse. That goes hand in hand with our school-based prevention. So our age-appropriate education in schools, that's what we do at FAN. We go out across the entire state of Michigan, not just for school-based, but also we do prevention in senior living homes, which is really popular. We are seeing a large number of senior citizens over accidental overdosing in the state of Michigan, or even they are, intentionally overdosing to end their life. That's another avenue that is happening through prescription drug misuse. But a lot of seniors, they take a medication and then they forget, and then they go and they take another one, and that could lead to an overdose. So we do a lot of education with our senior population as well. The middle group in between, doing education like this where we're touching on both youth and adults, so that way they could see the whole spectrum. So it is important to keep this education going. Obviously, we're still in the opioid epidemic. There was a big push for prevention education during the opioid epidemic with the DARE program, but now that national program has been debunked, if you will, there isn't national or even a state standard for prevention education for youth regarding substances. So I know we're really pushing for that. We really try to connect with our schools and our community members and push for as much prevention as we can, because it is really, really important. So that way this new generation understands the risk of all these medications, and we keep ourselves informed about the changes. So one of the really big things that I try to educate, especially our younger folks and our seniors, is following prescription guidelines and teaching people how to read their prescription bottles. The amount of people that don't know how to accurately read a prescription bottle and what all of the different codes and different numbers are for is pretty scary. So we always talk about, read the labels carefully. Follow the prescription labels exactly as written, including dosing instructions and timing. It'll tell you if you should be taking it with food, if you can't take it with other medicines, how often or at what dosage you should be taking it, the timing, every 48 hours, whatnot. Really teaching people to read the entire bottle. The amount of people who just read the front say, okay, take it once a day, and they take it, and it's like, oh my gosh, it made me so sick because I didn't take it with food and it was supposed to. So another thing is communicating with your doctor. Any concerns, side effects, or questions about your medication. Obviously that seems self-explanatory, but the amount of people who just go to the doctor, get a prescription, and then go home and just take it as prescribed, or they call the pharmacist and say, I'm experiencing these different side effects, when in reality we should be calling our doctor and letting them know, because maybe they could prescribe you something different, or maybe you need to go back in and have another consultation with your doctor. So that's an important thing to continue to communicate about. Obviously, never sharing prescriptions. We talked about that a ton. And don't adjust the doses on your own. Of course, we don't want to increase, decrease, or stop medications without consulting your healthcare provider. Can't tell you the amount of people who are just like, oh, I just stopped taking it. Especially when it's like a benzodiazepine or any type of like mental health medication where they can get really, really, really sick. Even with opioids too, type of medication, really, you can get really, really sick and put yourself into withdrawal if you just completely stop taking medication. So I always have the conversations of, make sure you're consulting your doctor when you want to stop your medication, because some of it may need to be tapered or weaned off. And people don't know. So I know I talked about MAPS briefly. So just to go over it, there's an electronic database that controls substance use prescriptions dispensed in Michigan. It allows providers to view patient prescription history, identifies concerning patterns like multiple prescribers, mandatory for prescribers to check before prescribing opioids. This is where it can get a little hairy because different people may be inputting different prescriptions and whatnot. And a lot of times it's integrated with electronic health records. And since 2017, Michigan has seen a 31% reduction in opioid prescriptions because of this system. So it is really important. It still works. Obviously, might have a tiny bit of downfalls, just like anything, but we should be promoting the use of it and the importance, and also educating patients that these types of monitoring programs exist, and that they can get in trouble if they were to try and doctor shop because they may get caught through this type of system. So when we talk about coming off of any type of prescription drug, or say if someone does have a full dependency or they are addicted to prescription medications, there's a lot of different treatment options. It's not a one size fit all depending on what somebody may need. Obviously, we want to promote that there's individual counseling, maybe better with someone who has mild to moderate substance use or stable housing. They have support. They're able to attend a session and then go home. When we talk about IOP, or intensive outpatient programming, where you go into a certain facility for a certain amount of hours per day, that's really, and then you're able to leave at night. That's really good for people who are trying to maintain work and family responsibilities. It gives them the option to be able to leave and also come back and engage in their treatment modality. If someone has a severe dependence to prescription drugs, we may recommend that they go to a residential or an inpatient treatment center. So that way they stay in a facility for a certain amount of weeks. Usually in the state of Michigan, it can range anywhere from 14 to 28 days. We want to make sure that they are getting the assistance that they need, and handling whatever they need to handle within that confined environment. And for long-term prescription medication management, there's medication-assisted treatment. It works very effectively for alcohol and opioid use disorders. So if someone is addicted to opioids, they can use medications like methadone, buprenorphine, or naltrexone to decrease their likelihood for relapse, decrease their cravings, and the effects that if they were to put opioids in their body, they wouldn't experience all their effects. So that could be really good as a medication management, and also for someone who is trying to maintain recovery but needs that extra assistance. So it's not a one size fit all. People use this in a lot of different ways. They combine different therapy modalities to address their substance use. It's a very large continuum of care. There's a lot more treatment options available than just these. These are just the most common for prescription drug misuse, but it can change over time, and people can integrate other things like recovery support beyond clinical treatment. So when we talk about mutual aid groups, obviously 12-step recovery groups, but there's also something like SMART recovery, which is like a biblical 12-step, refuge recovery, and Dharma are Buddhist frameworks. Celebrate recovery as well, or celebrate recovery is actually the Buddhist, the 12-step biblical. SMART recovery combines two different therapy modalities. But obviously we want to make sure someone has connection in their community, that they're able to maintain their sobriety by having, community of people who are going through the same thing. There's recovery housing, so those structured living environments that are committed to abstinence. There's different requirements for testing, for meetings, or different type of support. Very good for someone who doesn't have a safe place to go to, or a good living environment, or they don't have a home at all. There's other recovery community organizations like FAN that are led by people in recovery that provide peer services and other, community events and whatnot. We have a ton of services available. And then there's also employment support. So different recovery friendly workplace initiatives and supportive employment for people who are struggling with SUD. So obviously we want to make sure that they have this and combined with their clinical treatment too. So there's obviously, these are some recovery support networks. There's so many other ones. Obviously FAN. We have 30 chapters across the state. We also have a program that is an access to treatment program like Hope Not Handcuffs. We do naloxone distribution and education. There's different recovery community organizations all throughout the state as well, who are ran by people in recovery, like I mentioned. Michigan Opioid Collaborative, or Michigan Open, as well. They are provider and education support. So continued education regarding all of these different substances. Super important to do continuing education, the landscape of treatment resources, and the support that's available is continually changing. And us as providers or people who work with people who struggle, we need to make sure that we are as knowledgeable as possible. And then Michigan also has an initiative called the Recovery Friendly Workplace. I actually work on that project in combination with MPHI, or Michigan Public Health Institute, where it is employer education and support. So the goal is reducing stigma in employers. So that way we can support our people who are trying to navigate recovery in the way that we need to. It is a free training. It's a 4-part training, and you can become certified by MDHHS as a recovery friendly workplace. So it is a super simple process, and I highly recommend it for anyone who sees that it could fit in their workplace. Obviously, I think it could fit into everybody's workplace because most people hire somebody who's experienced substance use in one way, shape, or form. So if you are interested, you could simply Google Michigan Recovery Friendly Workplace Initiative. It'll take you right to their website, and you could fill out, an interest form. And it's a super, super easy process, but also it welcomes people in recovery to want to work for you. So that's just another thing that we could do to support people from a community aspect. So there's a lot of things that we can do from a cross-sector collaboration. So law enforcement plays a huge part in this puzzle, through diversion programs, through carrying naloxone, and using their best judgment to refer to treatment or different programs rather than arrest. That's a big thing that we're doing at FAN, educating law enforcement about our programs and trying to refer them or divert them into our programs. That's an easy thing. I say easy, it's really not as easy as it seems, but something that we all could work on to educate our law enforcement and our community about the importance of treatment rather than incarceration for people who are using prescription medication or just substances in general. But for the sake of this presentation, we see a large increase in overdoses when someone is leaving prison or leaving jail, or they've had or the hospital, or they've had, a increased period of abstinence. So law enforcement plays a role in that. So it's like I said, not easy, but a tangible thing that we could do in our communities that's super important. We talked about school prevention a ton. Early intervention is so important. So connecting with your local schools about prescription drug misuse education or just substance use education. If you do not have the resources to do that, FAN provides it for free across the entire state. If you look at our website, I'm happy to help if you put in, a request form there. Engaging our recovery community into all of these conversations is super important. We want to find our local people in recovery who can speak about these issues firsthand. If we should always have someone in recovery who's in the room. Personally, I'm not someone who is in recovery. So I have a team of people who are. I bring them into all these conversations where they can provide the advocacy for their community because I'm a family member who's been affected, but I don't have that personal experience, and people in recovery have to be part of the conversation. When we talk about the government aspect, there's certain policies that we could work on our local level. There's funding that's available for these types of programs, data tracking, coordination. Obviously, that's a higher level. But if you have the means or you're connected to even your local government officials and talking about what's going on in your community, super important way to advocate. I know, like in my community, our representative does like a monthly open office hours, as you will, but it's like a coffee hour. He provides coffee and you can go talk to him about, what you're experiencing in your community, so he can go out and, work with the state on changing certain laws and whatnot. So look into those types of opportunities and advocate for the importance of prevention. It's so important and it's severely underfunded. Um, and then lastly, our healthcare providers. So I manage a program called Hope and Healing, excuse me, within my branch. And so I work with 27 different hospitals across the state of Michigan and providing their providers, nurses, social workers with the education of what we're seeing on the community aspect about substance use and the importance of treatment access, and working with them and on training them on how they access treatment resources. So work with your local healthcare providers outside of MAT and substance use. There's a lot of different things we can do to get the cross-sector collaboration. So think about what's going on in your community and who are the maybe outside people that we don't immediately put in the conversation, and engage those people and have these open brainstorms about what can be done, because it's a really awesome way to get a community collaborative, but also showing our people who are struggling with substance use that we all care, and we're all going to try and put effort into this to change the current cycle. So just to touch on that, preventing prescription drug misuse requires collaboration among multiple sectors in our community. When we work together, we create a comprehensive support network that protects the most vulnerable community members. So one other aspect, we talked about health, we talked about education, law enforcement, but also community organizations, faith-based groups. I can't tell you the amount of churches that we've worked with to host Narcan trainings, or they just open up the space where we could do a community forum, partnering with different nonprofits that are outside of the substance use landscape. So domestic violence, human trafficking, housing. We've done food banks, different partnerships with them, providing education to the people who are seeking their services. So there's a lot that we can engage our communities with. And so think about the out of the box ways that we can partner with other people and provide education. So a couple additional things that you could do when we talk about community prevention programs outside of just schools, drug take back events. Those are really popular and they do very well. Usually you have to have a partnership with the police and a space to do it. Um, so, but they are kind of easy to implement. I'm going to put a toolkit in the chat from Michigan Open on how to implement one of those in their community. Also parent education. So it's important to educate parents about the trends that are going on with children, and also talking about prescription drug risks and securing medications at home is super important. I noticed in the chat it says, where are 14-year-olds getting benzos in high school, buying it off the streets, parents medicine cabinets, so when we talk about where people are getting this from, there's a lot of different methods. So they can get it from parents, grandparents, people that they trust, aunt, uncles, people who have these medications in the home. We are seeing an increase in teens buying medications online, whether that's through Snapchat, through social media. Different people just have them, sell them, or they have fake ones. Kids are buying them online. You could buy them off the street, depending on if drugs are commonly open and aware on your street. I would like to say that not all teens are going to drug dealers, if you will. But you can buy them, through people. Most teens get substances from someone they know. But they don't know who that person got it from and who that person got them from, and if it's an actual real substance. How is law enforcement involved in prevention and monitoring? So that really comes down to education. So we work with our local law enforcement to teach young folks about, to come into schools and talk about the dangers of medication and whatnot. We also go out and educate them ourselves. Law enforcement can be involved in a lot of different ways. It just depends on each agency is completely different, and what they're able to do is completely different. So we work with them and we try to, host events that are sponsored by the police, or, National Night Out is another example where, we may work with them and have educational tables. And so we're able to, they host an event, but we're able to provide the education about the dangers of prescription drug misuse. So really it's about being creative, figuring out what your partner organizations are able to do, and then going in and providing the information. When we talk about awareness campaigns, there are different PSAs. We work very hard to get our social media and other community organizations to spread the word about it, whether it's printable cards, or we do like educational posts on TikTok and Instagram and Snapchat and all of those to try and reach different audiences. And then I talked about the healthcare provider training as well. I think I skipped one slide, sorry, about storage. So let me try and find it so that way I can make sure that we talked about storage. I did skip it. Okay. I want to make sure that we mention this because it's just as important. I did skip it. All right. So just to kind of end on what we can do as, people who may have medications available, safe medication storage and disposal. It is very, very, very important that we have safe storage practices, and we're also disposing of medications properly. So we need to keep our medications in the original containers with labels, so that way people know what they are. So that we don't accidentally misuse something. Store them in locked cabinets, drawers, or medication safes. So there's different programs. Like I work with the Grosse Pointe Harper Woods Community Coalition, and they give out like medication lock bags, where you can just put it in there. It comes with a code, you lock it, you put it away. It's really important not to leave our medication in like open areas where anyone can access it, where we're not really watching it all the time. Even like medicine cabinets, we want to make sure that it is locked if possible. Super simple to do. I mean, it's just one of those extra steps that we can take. Keep track of pill counts and refill dates. So if you aren't locking up your medication, just know like, what do you have? How much do you have? When should it be refilled? So that way, if someone is taking something from you, or maybe you forgot, you took an extra pill yourself, you just got to go back and recount them. Never store in inaccessible locations, bathrooms, kitchens. Obviously, bathrooms are a big one. You never know who's going to go you should know who goes in your bathroom, but anyone can go in and access it. It's a closed environment. So really being diligent about where we put our medications. Like in my house, we put them in our safe. The children don't know about the code. And so we put them in our safe. We know that it's locked up. We know that they don't have access to them. That's just a very simple way to do it. You could consider special devices like timer caps and whatnot. If you aren't able to lock it up, those can be manipulated. Like I think I have a medication lock box with you. I have this medication lock container. This was given to us. A manufacturer was making it, and he gave it to me ahead of time. But the problem with these is this is plastic. So if you had someone who really wanted to get into one of these, they could probably take a hammer and crack it. It's not like it's metal. It can be effective maybe for like young kids who don't have the strength or don't have the dexterity to like move around the numbers and figure out the code. But maybe for older generations who have a little more cleverness, this may not be the best option. But there are different tools like this that are available. We give these out for free. They're great for some people. I would just recommend that if you have older adults who are struggling with substance use disorder or prescription drug misuse in your home, then maybe you don't use these. Maybe you invest in like a safe or something that is not as easy to break into. So safe disposal and non-safe disposal, because it's so important. Most police departments and pharmacies will take back your medication. They may have boxes. I live in Macomb County, and every single police station in Macomb County have medication prescription disposal boxes, but not everybody's going to be comfortable taking their prescription medications to a police department. So there are home disposal methods available. There are these Deterra bags. They are drug deactivation pouches. They're made of charcoal. You can put pills, patches, or liquid in them. You put in water, you put in the pills, you let it foam up, you close it, shake it, and throw it in the ground. We shouldn't be using kitty litter or coffee grounds, and we should not be flushing anything down the toilet. So really being diligent about how we're disposing medication, because if we're flushing anything down the toilet or putting it in our trash, it's going to get into our water and our ground, and we already have enough problems with our water quality in the state of Michigan and as far as Lake St. Clair, so let's not add to it. But there are some mail back programs as well. Those are just not as common and usually aren't free. So definitely research how you can dispose of medications in your community, but you can take them back to pharmacies. That's probably the easiest place. So to close out, as a community and to recap what we've talked about today, so we all play a role in our prevention and response. So we should continue to educate those around us about the risks that are associated with prescription drug misuse, providing accurate education, of course. We should secure our medications and dispose of them properly when need be. We could continue to support people who are struggling, letting them know that there are different treatment modalities available. And we should collaborate with our local community on increasing prescription monitoring, increasing prevention, make sure, we're decreasing doctor shopping and decreasing the amount of medications that are being prescribed and promoting maybe more holistic measures of recovery. So I want to thank you all for your time today. I know that was a lot of information. So if anyone has any questions, I'm happy to answer them. And thank you all so much.
All right, I was just going to give a couple seconds to see if we get any questions that come in before we wrap it up here. Just seeing a lot of thank yous. There was a lot of really good information, very helpful, just to know what to look for, I think, when talking about prescribed medications. Still some more thank yous, great information. Appreciate all the resources also. All right, it looks like we're mostly just getting thank yous. So I'm just going to go ahead and wrap up. I want to thank you, Maddie, for sharing your time and insight, all the useful information and resources for people to be able to get help if they need it. I want to thank everyone who attended today. We hope the information was both valuable and meaningful. Today's presentation is just one of many webinars being offered throughout September as part of our Recovery Summit. For details and registration for upcoming sessions, please visit our website at www.sccmh.org under the Events tab. Also, please keep an eye out for a short survey in your email. Your input is vital in helping us continue to improve and shape future events such as the Recovery Summit. For those requesting McBath and peer certificates, they will be emailed out mid-October. If you're requesting social work CEs, your certificate will be emailed to you after payment is received, if applicable. Thanks again for joining us today, and thank you again, Maddie. We'll see you again next Monday, I believe.
Yep.
We look forward to seeing all of you again at our next session. Thank you.
Thanks, Christy.